we've known each other for not that long.
No.
I would like you to tell me your stories if I'd never heard them.
It was in 2016, right before April. And I was going to work, and I was driving, and I felt something sharp under my left armpit. And when I went to feel it, I felt 3 large nodules, very hard as a rock. So when I found out, I called my doctor, my primary physician, and he believed that it was basically an infected gland because I had just recovered from pneumonia, and gave me antibiotics. By the 5th day, I knew that this was not an infection. So I called his assistant and said, we have something else going on and it needs to be checked. So they referred me to a local surgeon. They did a surgical biopsy because it was too big and found that it was HER2 positive cancer. From there, I was referred to a local doctor who couldn't see me for maybe 4 to 6 weeks. So I called my surgeon back, and she said, you won't be here in 8 weeks.
She actually said, you won't be here in 8 weeks?
You won't be here in 8 weeks. So I ended up finding somebody else. I had chemotherapy and radiation, and did fine through that, 6 months, and I was pretty cleared. But 4 months later, I ended up with brain cancer. I have 4 so far of tumors, brain tumors. I went to a neurosurgeon that did the biopsy, and it was positive for HER2. They were planning to remove the tumors, but they would have to literally cut my head open. But the problem with that is it will cause blindness to each eye. And because of that, I just said I didn't want to go in that direction. I wanted to try something different. So they started something that they use for patients that have had seizures. It's ablation in the brain. This was the first thing that they did with me, and the results are pending. One day I was really sick, very nauseated, just no energy, couldn't walk, couldn't get out of bed. So I ended up in our local emergency room. And their advice was, you really need to have a local doctor. So they referred me to you. And I had known about you because I had done a research at another hospital out of state that you used to work at. I think it was a divine intervention because I ended up coming to see you, and just loved you from the moment that I saw you. You're very open and listen to what my needs are, which I really appreciate. And we started having the Herceptin treatment, and I've been feeling a whole lot better since.
You got a little Herceptin based on the only prospective randomized trial that is asking the question, what if we take away a drug that has worked and do whatever else we're going to do, versus if we keep using a drug that has worked?
Well, if it continues to work and you live life longer, you'd be crazy not to continue taking the medication. I mean, my opinion. So the thing I like about the ImmunoGenetics is that if we can get a sample of the brain, which we can, during that procedure, then you can check the sensitivity. I think that's a great breakthrough for all of us with cancer, to have that sensitivity and to know what medications that's going to be more effective for us. I think that's wonderful.
If we can just keep doing it over and over and over again on individual patients, then we're doing the latest thing in medicine, which is precision medicine. That's what we do.
Yeah. Thank you very much for everything and keeping me here. So
that's the goal, survival.